Well, good afternoon. Thank you for being here. My name is Bruce Harrell. I'm the mayor of the great city of Seattle, and it's absolutely my pleasure to better describe sort of in detail a new system we're trying to implement. We'll call it the Seattle Fire Nurse Navigation Program. We think that's pretty catchy to describe what we're trying to do. May take on another name at some point, we don't know, but what's most important is we're looking at our 911 system, and we're trying to develop more ways to better serve those in need, to make sure our response times are where we want them to be. This is going to be a great partnership that we're developing, and we think that the employees and employers and the residents of Seattle will be better served by this new kind of partnership we've struck. So the mechanics are going to be of interest to the public, and we want to explain that. We're going to have Chief Harrell Scoggins describe it in better detail, and we're going to have our chief nurse, Lisa Edmondson. Let me make sure I have her title correctly, the Director of Nurse Navigation, if I'm saying that correctly. But between Lisa and the chief, we'll answer some questions on the details. At the end of the day, we're looking for new ways to serve the public. We're looking at new ways to serve those in need of crisis. We're looking at new ways to free up our system and free up some of our resources such that we can get those 7-minute response times that we want to make sure everyone feels safe. So I'm very proud, always proud of our fire department and the great work that they are achieving. And so with that, I'm going to relinquish the microphone to Chief Harrell Scoggins of the fire department.
Thank you, Mayor. Thank you. Good afternoon, everyone. And before we get started, you know, as the mayor has gotten off to a fast start, I wanted to take a couple of minutes to just thank him publicly. You know, we had a pretty hard month in January with the Seattle Fire Department, and we had 3 memorial services in January. And I want to thank the mayor for taking the time to attend all 3 memorial services and meeting with the families and speaking at the events. And our firefighters and all of our members of the Seattle Fire Department really appreciate the mayor's presence, and he really made a difference, and we heard so many positive comments. So thank you, Mayor. We really appreciate that. And I also want to thank the mayor for his support of this program that we're here to speak about, and it actually has already launched today, so things are actually starting to happen. You know, it's really important that we continue to find new ways to serve the community. And Councilmember Herbold couldn't be here today, but I want to thank her for her ongoing support and the City Council for this program. We've been working really hard with our partners on this program, and we think that we're really going to make a difference. So the Nurse Navigation Line actually launched this morning. Today is the first day of the program, and when I got here earlier today, I walked on the dispatch floor, and they said the calls are already coming in. So I want to tell you a little bit about the program and what we hope to accomplish. You know, and it's also important to note that there's less than 10 fire departments across the United States that actually have a program like this. I just spoke with Lisa, and she said we're actually number 6. We're first on the West Coast in trying to make a difference in how we better serve our community. So oftentimes the 911 call comes into the center, and if we only have one resource to send and one way to get them to the hospital, that's really limiting for us. So what we saw is an opportunity to better serve community. If there's those lower acuity calls or calls that may need a little more conversation, we now have a system in play that can actually help. So our dispatchers, they'll take the call, they'll triage it with our EMD protocols, and if it's a lower acuity call or another type of an issue, they can now transfer that call to actually a nurse navigator who can spend the appropriate amount of time on the call with the caller to actually get them in the best place that they need to be. So what does that look like? Well, if they need to self-care and self-treatment, the nurse navigator will be able to help with that. If they need an urgent care appointment, the nurse navigator will be able to help with that. If the caller continues to get worse on the phone, they can transfer it back to our dispatch center, and we can get our 911 call, our 911 resources en route. Or if they need a lift ride to the hospital, the nurse navigator will be able to do that. So what we know is a program like this is going to help us better serve the community in really getting the patient to really where they need to be. So here are a few examples of some of the things that we hope to address. Some of the chronic issues like abdominal pains or lower back pains, that we get a lot of those calls, or mild flu symptoms, or COVID issues related to testing, or vaccination questions. We can transfer those to the nurse navigator. All these are really critical where people really need help, but it really doesn't need to be a part of the 911 system. And that's pretty important for us in trying to keep our resources available to be prepared to respond. We also believe it's going to bring a cost savings to the caller calling 911. Well, why is that? If we can transfer you to a nurse navigator, well, you probably may not need an ambulance ride to the hospital, which can trigger an ambulance bill for you. And that's going to be important for you too. We think it's going to decrease the overwhelming of our emergency rooms. Oftentimes, people go to the emergency room and, you know, they have really injuries that really don't, injury or illnesses that don't need to be in the emergency room. So we can actually get them to where they need to be. And then we'll be able to keep more AMR units available on the street. So when we do call them for those critical 911 responses, they're available, and keep our fire department resources available. All these are going to be critical for our system as it continues to expand. So we in the Seattle Fire Department, we continue to look for new and different ways to better serve community. We're excited about our expanding partnership with AMR. And next, I would like to turn the mic over to Lisa Edmondson to talk a little bit more about the program. So thank you.
Thank you. Thank you, Mayor. Thank you, Chief. On behalf of Global Medical Response, I really want to thank the city and the fire department for helping us and getting this program going, in collaboration and our partnership that we've had. We've been working together on this program since October. We've got small work groups with the clinical patients and the quality that can come over. We've got a work group that worked on that. We've got the detailed call flow process that has been worked on from the call to the nurse and the nurse back to the fire department and over to AMR. We've got our alternate destinations. We've really got a lot of good partners here in Seattle, whether those are urgent care clinics, walk-in clinics. We're looking at our FQHCs, those federally qualified healthcare programs, because what the nurses do is they match up the alternate destination with the insurance. So we're only going to send those qualified candidates to where the services that they need are there and they accept the insurance. And this is how we help make a healthier healthcare system. So it's been very exciting working with these groups. We've had the fire department working with it. We've had local community leaders as well as the AMR leaders that have really banded together. And then, of course, our community education partnership group that has done an outstanding job of getting this out there, educating the community, and really wrapping their arms around this. It is a good program, a much better care at the right time for the callers to help alleviate the overburden of the system. So very exciting to start today. We know we've had successful calls already today and looking forward for this growing. Thank you.
Thank you. All right. With that, we'll field a few questions, and if you have any, and again, I wanted to reiterate the fact that Councilmember Herbold just had a personal challenge, but she would have been here also to represent the City Council, and I want to thank the City Council for work that they've done pursuant to this deployment as well. Are there any questions? Yes, sir.
Hey, how you doing? Ahead of launching this program, was the fire department gathering data on roughly what percentage of the incoming calls would likely be directed to this nurse program?
Yes. So in 2021, our dispatch center received about 160,000 911 calls into the system. So we took a very conservative approach, and what we believe is 8,000 to 10,000 of those calls will be able to start off in a system like this. And as we grow and learn more each day as the calls come in, we'll be able to expand or contract as needed. And that's been done under the guidance of our medical director, Dr. Michael Sayer, and our fire alarm center team. I do want to give special thanks to the members at the Fire Alarm Center for being so open to this change, and Hilton Almond, who's in the back of the room over there, who's been very intimately involved in this process. But what we think is about 8,000 to 10,000 911 calls will be able to go into the system immediately.
Thank you. Okay, with that, we'd like to thank you again for being here this afternoon.
I have an off-topic question, if you don't mind, for there.
Well, I was going to try to get through the day without that, but of course, I've always welcome questions.
The city attorney yesterday said that she was outlining a plan to announce charges within 5 days of a misdemeanor happening in the city of Seattle to clear that some 5,000 case backlog. Any comments, any thoughts on that?
Well, I'm going to support our elected city attorney on her strategy to address the backlog. I have repeatedly said that moving forward, we want our arrests to be valid and lawful and free of racial inequity, but we also have to make sure that we are addressing crime, that all communities want to feel safe and be safe. So again, with just a few weeks behind us, we'll work with the city attorney, and I appreciate her willingness to address the backlog that certainly did develop. So we're supporting what she's trying to do. We'll make sure all communities are listened to in the process, including the defense bar, including representatives from communities of color who are concerned about, again, racial inequities. But certainly the backlog needs to be addressed, and I think she's showing leadership in that regard. Okay. Thank everyone again for being here. Any parting words? We're good? Okay, one Seattle.